So I'm from London. I was born and bred in London. I moved to Australia in 1998. Initially came on a working holiday and fell in love fairly shortly after that with Queensland and especially the Gold Coast. So my first job on the Gold Coast was in 2000. So that's 18 years ago. Gee, I've been around for a long time. So on my first job, when the first time I came to the Gold Coast and lived here for a year, I decided pretty much within months that I was going to live here, and I went to Narrow Neck and made a vow to myself to live on the Gold Coast for the rest of my life. At that point I wasn't training in plastic surgery, I was doing orthopedic surgery, and I've done a fair few different specialties. I did a lot of general surgery, did some cardiac surgery, transplant surgery in Sydney, and then I finally decided, which I sort of had an inkling towards in the past, but I finally decided after doing a job in plastic surgery and reconstructive surgery that that's what I wanted to do long term in my life. And the reasons for that is basically because plastic and reconstructive surgery is very unique in that it's a very diverse skill set. You do stuff that is fairly artistic, which is something I enjoy, but at the same time it's scientific and academic. And I like that milieu of the two, which is unique to plastic and reconstructive surgery. I've always been more interested in the reconstructive side because that's where more of the complex surgery is, and it's more functional surgery, so you're delivering patients outcomes that are really rewarding to myself personally. But I do a lot of cosmetic surgery as well, which really for me is more artistic than functional. And that's, I have a balance in my life of how much of that I like to do and how much of the more complex stuff I like to do, and that's where most of my interest is in the reconstructive side. But that skill set that you develop by doing much more complex procedures per se allows me to deliver a much more, I feel a better result to my cosmetic patients because I have a wide skill set and I can use those maneuvers into delivering better outcomes that are better tailored to an individual patient or an individual problem, especially if they've got an underlying asymmetry or something of that nature, which I can find little tricks for that I use mainly for reconstruction, and utilising those I can deliver a better result.